we have this direct positive relationship between our lifestyle, modifiable risk factors, and cardiovascular wellness, where positive changes in diet, exercise, and stress will positively impact inflammation, blood glucose, blood pressure, and our blood lipids. This is our cholesterol and triglycerides. Now, unfortunately, when we lead unhealthy lifestyles, our risk of cardiovascular disease increases due to any combo of chronic inflammation or blood glucose management, high cholesterol, and hypertension. Now, remember, these factors all interact with each other. So most of you who lead stressful lives, don't exercise regularly, and possibly are overweight or have poor dietary habits, then you likely have one or more of these issues. And if you do, then we run risk for compromising our cardiovascular wellness. Now, in the next couple of slides, I'm going to give you some actionables that you can then start right away to optimize cardiovascular wellness. So using the past slide as a model, I'm going to go through different ways we can modify those different variables so that we don't have to worry so much about, having these poor genetics or picking our parents wrong or whatever's going on in our life, so that we can actually take control of our cardiovascular wellness over time and make sure that we don't have to deal with any issues down the road. So when we look at stress, chronic stress really is the killer. Everybody undergoes stress, but it's our stress resilience that we have that really gets us through these stressful times, so they don't become something that's an ongoing issue without even having any sort of trigger, if you will, for the issues that prevail due to stress. So chronic stress, using this little figure that I got from Neuroscience and Behavioral Reviews, it's relatively recent. We know that chronic stress impacts health risk behaviors. So when people are chronically stressed, they overeat generally, their physical activity goes down. They generally get into substance use, that could be drugs or alcohol, and they have sleep deprivation. These are all big problems for poor health outcomes. Now, the primary mediators in the body of this, when we have this chronic stress, are driven by the sympathetic nervous system, driving cortisol upward and driving inflammation in the body through inflammatory cytokines. Now, what ends up happening in chronic stress is we get a lot of inflammation. We get dysregulation of cortisol. Cortisol is actually not a bad thing to have on board. We need it. But when we get dysregulation of cortisol, then we end up with a whole bunch of inflammatory cascades, as well as oxidative stress that can drive some primary outcomes. And these primary outcomes under a allostatic state, so what this means is under a state of stress that we're managing, tend to have cardiovascular, metabolic, immunity, and brain outcomes. So cognition outcomes. Now, if we allow this chronic stress to prevail, we start getting secondary outcomes. And this leads to health risk behaviors, which then lead to hypertension, cardiovascular disease, myocardial ischemia, obesity, type 2 diabetes, increased infections because of decreased immunity. We can get colitis, gut health issues, ulcers, and asthma. And we see depression, anxiety, and PTSD in these cases. Now, if these chronic stress conditions prevail even further, so we're talking, years now we'll start to see serious pathologies and functional decline, premature aging, cognitive decline, as well as some depressive and anxiety symptoms. And also it will affect our longevity over time. So we really want to get stress under control. So here's a few stress management tips that I may be repeating things for you folks, but I'm going to drive them home today, and hopefully you'll learn something from them. So the top one actually in the literature is to practice mediation and mindfulness. So in order to become more resilient to stress, if you practice being present and staying in the present moment, as opposed to thinking about what could happen in the future or stuff that's happened in the past, you tend to have less stress throughout the day. This decreases the chronic nature of it and will definitely help with your blood pressure and your overall outcomes. Now, if we're talking about blood pressure, if you do have a slightly hypertensive measurement one day, I want you to measure this 3 times. I want you to sit back, take a measurement. If it's slightly high, I want you to stop, sit down, and practice focusing purely on breathing in and breathing out for 3 to 5 complete breaths. Do this until you can complete 3 to 5 complete breaths. Take your blood pressure again, and you'll probably find that your heart rate goes down quite a bit, and you'll find your blood pressure normalizes. Develop good sleep hygiene. So we know that sleep is a very, very important part of our cardiovascular health. It's when we do our most repair. Good sleep hygiene requires you to get to bed and get in good time and get, about 7 to 8 hours sleep. You want to make sure your room's nice and cold. You want to make sure it's really dark. You want to limit your screen time right before you go to sleep. Limit your eating to 3 hours before you go to sleep, and don't drink any alcohol if you can at all, but especially within 3 hours of sleeping, because that sleep's going to really, really help you with your stress a lot more than the couple glasses of wine will. A big problem in our society is that we don't manage time well. So we're always kind of running around ragged. Develop some time management strategies if you find yourself constantly stressed over time. Otherwise, you will end up in this condition. Create boundaries and self-limitations. This is a super important one, especially what we learned during COVID. When people don't have boundaries for themselves and don't enjoy themselves in their own self, then we find that chronic stress goes up and we have trouble with stress resilience. This actually fits well within having a supportive social network. If you have a supportive social network, then you actually have a really, really high chance of decreased chronic stress. And this has been shown in a lot of literature. People who don't have a supportive social network and have toxic relationships tend to really suffer from chronic stress and health risk behaviors. Reduce your screen time. We've kind of already talked about this. Will help you with your sleep, but it'll also help you be less stressed. The more you're on your phone and the more your phone is attached to your work, then you'll find there's a higher propensity to be stressed out. Exercise daily, eat well, and now I'm going to talk to you about eating well. So, how do we eat well for cardiovascular wellness? Well, the Mediterranean diet is a dietary pattern that's inspired by traditional eating habits of people living in countries bordering the Mediterranean Sea, like Greece, Spain, Italy, and southern France. Now, it's widely recognized for its potential health benefits, and it's been associated with various positive effects on overall well-being and disease prevention. One of the most well-known benefits of the Mediterranean diet is its positive impact on heart health. This diet emphasizes the consumption of heart-healthy fats, such as olive oils and nuts, which are rich in monounsaturated fats and antioxidants. These fats have been shown to help lower LDL, the bad cholesterol levels, also shown to normalize blood pressure and reduce the risk of cardiovascular diseases like heart disease and stroke. Now, the Mediterranean diet has also been associated with a decrease in the risk of chronic diseases like type 2 diabetes and certain types of cancer like breast and colorectal cancer, as well as neurodegenerative disorders like Alzheimer's disease. The diet's emphasis on whole foods, antioxidants, and anti-inflammatory compounds contributes to these protective effects. Now, the diet's main focus is on whole grains, vegetables, fruits, lean proteins, and healthy fats that can support weight management and weight loss efforts. Now, as I've just told you in the last slide, if we can keep track of our weight, then we can also decrease inflammatory stress and chronic stress over time. So this diet is very high in fiber content, and the inclusion of satisfying foods really help regulate appetite and prevent overeating. The Mediterranean diet's array of fruits, vegetables, nuts, seeds, olive oils, this all provides a range of antioxidants and polyphenols that also have anti-inflammatory properties. Chronic inflammation is linked to cardiovascular disease, and the Mediterranean diet components help mitigate this inflammatory response that we see in patients and populations with cardiovascular risk. The studies do suggest that the Mediterranean diet may contribute to better cognitive function and reduced cognitive decline in neurodegenerative diseases. the omega-3 fatty acids from the high fish content of the diet, along with antioxidants and other nutrients, play a role in supporting brain health. And the diet's emphasis on whole grains, fruits, vegetables, and fermented foods like yogurt, kefir, you can use kimchi, those kind of things. This promotes a healthy gut microbiome. Now, a balanced gut microbiome is associated with better digestion, better immune function, and overall cardiovascular well-being because of its impact on our blood lipids and on our inflammatory responses, as well as our blood glucose responses. So most of those things I talked about that are involved in cardiovascular health are supported by this diet. And then finally, the Mediterranean region has some of the highest rates of these centenarians. These are people who live 100 years or more. And the Mediterranean diet is believed to contribute to this longevity. So the combination of the foods that I've just mentioned and an active lifestyle all play a role in this aspect. So if you don't want to go read about the Mediterranean diet tonight and learn how to do it, here's the quick Coles notes for you. Avoid highly processed carbohydrates, sugars, and cereals that are just made of processed food that are basically compressed sugars. Increase your dietary fiber or fiber intake, depending how you spell it. And for men, this means getting up to 40 grams at least per day of a mixture between mostly soluble and insoluble fiber. And for females, this is anywhere from 28 to 38 grams per day. And this is what I normally recommend. You can do this by increasing your vegetable intake. If you follow any of my posts on social media, you'll see that I'm I'm big on the vegetable intake. Make sure you're eating those berries for those polyphenols and that inflammatory stuff. Great for your guts, great for inflammation, great overall for health. Moderate saturated animal fat intake. If you do have any cardiovascular compromise, I suggest keeping this down around 10% of your total fat intake per day max. Increase your omega-3 fatty acid intake. Eat healthy fats, which includes those omega-3s, but also get them from olive oil, avocado, nuts, these kind of things. Avoid alcohol if you can at all costs. And maintain healthy caloric intake so you can maintain a healthy body composition. This is probably the number one thing you can do to improve your health, is to keep a healthy body composition by not overeating. Okay, so one of the best ways to optimize our cardiovascular wellness is through exercise, like I talked about a few slides back. Now, if we optimize our cardiovascular wellness through a fitness-focused lifestyle with regular exercise, then we don't have to worry about these effects that we see with prolonged sitting. So the best way to highlight the benefits of exercise on cardiovascular wellness is to look at the studies involving prolonged sitting or lack of exercise. So I'm just going to go through this figure. So we've talked a lot about sympathetic nervous system activity and blood flow and all these things. And what we know through prolonged sitting, and this is taken from Hypertension, a very well-respected journal, there's a review in there, is that prolonged sitting leads to vascular, autonomic nervous system effects, which control our fight or flight stress nervous system, as well as our relaxation, parasympathetic nervous system. But it also affects metabolic actions in the body. And so what we end up seeing is we get less blood flow throughout our body from this. Increased sympathetic nervous system activity causes vasoconstriction and some kidney dysfunction and problems there. And we get these metabolic problems, which really result in decreased muscular activity, which leads to atrophy of the muscle or loss of muscle mass. And we get increased post-meal nutrient load. So we end up eating too much, and a positive energy balance, which increases obesity or obesity-like symptoms. At the end of the day, this increases all those things that I said, aren't good for cardiovascular wellness: oxidative stress, low-grade inflammation chronically, and poor metabolic signaling in the muscle, liver, adipose, vascular tissue, and blood. At the end of the day, this all results in these clinical risk factors we've been talking about. So problems with our blood lipids, high cholesterol, high triglycerides, these kind of things, hypertension, so high blood pressure, and also dysregulated blood glucose. At the end of the day, we end up with cardiovascular complications, and I basically iterated that for a few slides now. So we really want to avoid having these situations at all, any of them. Now, regular exercise, on the other hand, it gives us cardio protection, and it gives us stress resilience and even cardiovascular improvements. Now, this isn't just in people that are constantly running, but this is in people that actually have never exercised before and then just, pick it up and start going out for walks. You will see cardiovascular improvements when you increase your movement. So get sweaty on a daily basis, and you're going to notice a big difference in your cardiovascular wellness overall. So I'm a big supplement guy. I don't like to push supplements too much, but I do believe, and I do use these in practice to help a lot of my clients, especially the ones that are suffering from gut health issues and cardiovascular issues, so that we can support the diet, especially if we're in a caloric deficit, because we're dieting to reduce body fat for wellness. Now, one thing we do need to really, really drive home is that supplements will not override chronic stress, poor diet, lack of exercise, all those things I talked about that actually drive issues with our cardiovascular health. But numerous studies have shown that there are several compounds that can help us support our cardiovascular wellness. First one I mentioned here is taurine. So taurine has been shown actually to help the cardiovascular system through a variety of mechanisms, including improving the lipid profile, so your cholesterol. It modulates the concentration of calcium, which then reduces the effects of our diet on atherosclerosis and all these different things, and driving of the heart. And it has antioxidant effects and antagonism of angiotensin 2, which we're going to talk about more in the next slide. So taurine, the literature recommends 0.5 to 1 gram taken 3 times daily. This is 1.5 to 3 grams total daily dose. It's really relatively flavorless. You can mix it with your favorite juice or whatever you want. It's a powder. It's cheap, and it is cardioprotective. Vitamin C is just a really, really ubiquitous and highly, highly potent antioxidant. So if we can keep the oxidative stress down, then we can do that through vitamin C quite effectively and affordably. This isn't a very expensive compound, and it's recommended that you take 500 to 1,000 milligrams daily if your diet's not meeting that demand. Now, vitamin D3 deficiency has been linked to several cardiovascular risk factors like hypertension, but also dyslipidemia and diabetes. So super compensating your vitamin D, or super saturating your vitamin D levels, is not going to give you any extra cardiovascular benefit. But in my client roster, which is relatively large, I get about probably 20 to 30% of my clients that are vitamin D3 deficient. And it's amazing how well taking some vitamin D works to make things feel better overall. So not only for your cardiovascular health, but for your hormonal health, your muscular health, and your brain health, vitamin D3 is pretty important. Immunity, calcium homeostasis, you name it. Get your 25 hydroxy vitamin D3 checked before you start taking vitamin D3, because you don't need more than you need. And get your blood work done. And if you're low, this is my recommendation: 20 to 80 international units per kilogram of body weight. Magnesium taurate is an interesting compound. So this is magnesium that's chelated or bound to taurine. And I recommend 1.5 to 2.5 grams daily. Now, one of the things we need to recognize is that magnesium, when it's chelated, isn't all magnesium. Total mass that I'm recommending is only a fraction of magnesium and a fraction of taurine. So in this case, magnesium taurate is 9% elemental magnesium. So you're getting about 90 milligrams per 100 milligrams that you would take of this stuff. 9 milligrams, 9 milligrams. And you're going to get a heck of a lot of taurine. So if you're interested in taking taurine, I would recommend just taking magnesium taurate at 1.5 to 2.5 grams a day, and you're going to get the magnesium as well as the taurine in one shot. Omega-3 polyunsaturated fatty acids. So this is fish oil in general. You can also get vegan forms of this from algae. You want to get 3 to 6 grams of combined DHA and EPA daily. Just look at the back label of your fish oil and or your omega-3 supplement, and it will list your DHA and EPA. Add those together, and you want to get this much per day. You can take that in one shot in the morning or right after exercise, and this is going to help you with inflammation, but also kind of a relatively unknown fact, it will help with cardiovascular performance. So because the omega-3s coat the red blood cells actually become more slippery, to put it easily. And because they become more slippery, then there's less resistance offered by them when they flow. This actually has been shown to increase VO2, so your actual oxygen consumption rate, without ever changing anything else. So this is great. And it also decreases that total peripheral resistance that I talked about earlier that contributes to blood pressure. So omega-3s are great overall daily supplement. Melatonin taken 2.5 milligrams 1 hour before bed. This is going to help you with your sleep. But melatonin is also a very, very, very potent antioxidant. And very few people know this. So if you take a melatonin and it doesn't help you and you don't like it, don't take it. But if you haven't tried it and you're suffering from sleep issues, this is a very low dose. And you may find that it actually helps with your cardiovascular health as well as your sleep. And those will also integrate and make things even better. CoQ10 in the form of ubiquinol is the best form of CoQ10 that you can get. And the science recommends 200 to 400 milligrams daily. This is a very potent antioxidant, especially for the cardiovascular system, and highly recommended in those of you that have some lifestyle issues or anything like that you need to kind of make sure you get your oxidative stress under control. And olive leaf extract, the oleuropein that's extracted from that, has been shown in a number of studies to help with your blood lipids, help with oxidative stress, as well as cardiovascular health. So the recommendation in the literature is 500 to 1,000 milligrams 1 time a day. And you can find this stuff. Just make sure you find a product that tells you how much oleuropein is in it. Otherwise, it could just be literally the olive leaves themselves in the product. And finally, I want to really focus on these bioactive marine peptides. So this isn't collagen peptides. These are bioactive marine peptides. And the general recommendation is 1.2 to 1.5 grams daily. And I want to just highlight some of the reasons why I think this is the most novel thing out of this list. And Precardex actually produces the most bioavailable and potent form of these marine peptides. So I'm going to go through those right now. So food-derived peptides in cardiovascular wellness, a lot of times these peptides have been shown they can be derived from plants, they can be derived from milk, they can be derived from from meat, and a number of different marine species, and they have an array of effects. But pertinent to this lecture, I want to home in on ACE inhibition. But first, what is a peptide? Well, proteins are just links of a bunch of amino acids. Amino acids are their individual components of a protein. And when we break up a protein into fragments that contain 2 or more amino acids, they become peptides. Peptides are neat because they're small fragments. They can get around the body and cross the blood-brain barrier and do a whole bunch of stuff like that. And they have really unique biochemical roles in the body, which we're just starting to kind of uncover now. So food-derived peptides have antioxidant effects, antimicrobial, anti-diabetic, anti-obesity. They have multifunction effects, chelating effects. They can help with blood clots. But most of all, for this talk, a lot of them are ACE inhibitors. So what is an ACE inhibitor? This is an angiotensin converting enzyme inhibitor. And just to put this in a quick nutshell, basically, angiotensinogen from the liver combines with renin to actually produce this angiotensin 1. And angiotensin 1, through angiotensin converting enzyme, becomes angiotensin 2. Angiotensin 2, which we've touched on earlier, causes vasoconstriction of vessels, causes smooth muscle cell hypertrophy, and a number of other problems that can happen in blood vessels that increase total peripheral resistance, like we talked about, and blood pressure. The angiotensin 2 also causes sodium and water retention, which we talked about earlier about blood volume driving blood pressure up. We also know that angiotensin 2 has a whole bunch of chronic effects on the heart through like cellular hypertrophy and inflammatory cytokines. Not good stuff for the heart at all. We know that the angiotensin 2 promotes aldosterone secretion from the adrenal glands on the kidney. And we know that it increases vasopressin secretion in the brain, which is a vasoconstrictor, as well as sympathetic nervous system activation, which I've shown you ad nauseum today is not a good thing when we're talking about cardiovascular homeostasis when it's deleterious. So a lot of the drugs that we give to patients to circumvent blood pressure and cardiovascular issues are what's called ACE inhibitors. ACE inhibitors have a lot of ubiquitous effects in the body, but they do a great job at lowering blood pressure and protecting the kidneys and heart. So, in the spirit of these marine peptides, shrimp-derived marine peptides are the most potent and have been shown in clinical trials to be the best for cardiovascular wellness. So in a study in the International Journal of Hypertension done just a few years ago, they looked at the effects of shrimp protein hydrolysate on blood pressure. And what they found was that in these groups that took these marine peptides from shrimp-derived protein hydrolysate, these unique peptides favorably altered blood pressure in prehypertensive and hypertensive individuals. So this is shown in this graph versus this graph. And so overall, what they saw was a shift in the prehypertensive and hypertensive population to become less hypertensive over time. These favorable blood pressure responses were then found to be a result of decreases in angiotensin 2, the stuff we were just talking about in the last slide. And this is due to a natural ACE inhibiting mechanism of action. So a drug-free ACE inhibitor. So marine peptides that are derived from shrimp proteins, these are unique peptides, and especially unique because Precardex is actually has a patented version of these peptides that they've isolated themselves. What we know is from these studies is in that clinical trial I just highlighted in the last slide, it showed that 89% of the adults with mild to moderately elevated blood pressure experienced a significant effect within 8 weeks of taking these unique marine peptides. So over time, the population of those that saw blood pressure reductions increased. So it seems like there's a sweet spot of taking these for a few months. Now, compared to baseline, the average improvement in blood pressure from that study was 6.7 millimeters of mercury in systolic blood pressure, the top number, and 1.7 millimeters of mercury in diastolic pressure, the bottom number, and this occurred within 8 weeks. And the nice part about it, there were no serious adverse side effects reported by study participants, including hypotension, so low blood pressure, angioedema, so we didn't see any edema, no dry cough that's associated with ACE inhibitors, and there was no hyperkalemia, which we can see also with ACE inhibitors. Hyperkalemia is high potassium. When potassium gets too high, it stops the heart, and we are in a lot of trouble. So this is a great thing that these unique and novel shrimp-derived marine peptides can actually give this ACE inhibiting effect without having any of the effects that we see in ACE inhibitors. So I want to introduce you to Precardex. So this is a unique bioactive marine peptides, and like I described in the last few slides, and these have been shown in peer-reviewed clinical trials to have statistically significant effects on our blood pressure health. Precardex bioactive marine peptides have been clinically documented to have ACE inhibiting mechanisms of action. This is great because, as I showed you in the previous two slides, ACE inhibition is one of the primary means of us getting cardiovascular wellness when we're dealing with some blood pressure issues. Precardex is safe and effective. It's a non-prescription natural product for healthy blood pressure and cardiovascular health. And why would we choose this? Well, Precardex has actually got this novel peptide that works. I've used it in my my client base, like I said at the beginning of this talk. And I'll tell you, it's funny because, like I said, Precardex didn't contact me. I actually, my clients were tagging Precardex in their posts because we were having trouble keeping their blood pressure under control over time. And this was actually the only variable that we changed from our protocol, and it worked quite well. Precardex it's nice because it's sustainably sourced from the Arctic Sea in Norway, and it's made in Canada. And we have very, very high stipulations on how things are produced here. So you're getting good quality when Health Canada is involved. It's made with clinically validated doses of proprietary bioactive marine peptides, like I described in the last slide. And these are the ones that were used in the clinical trial I showed you. So well studied, well supported. And we know, at least through studies, that you're going to get something that has been shown to work. And with no serious side effects reported, and approved by Health Canada, the FDA, and also the EFSA. So very, very high quality product that's relatively effective for what we're trying to achieve. So Precardex has been studied in a non-medicated adult population who have mild to moderately elevated blood pressure without pre-existing medical conditions. And this is the indication for the current supplement. The dosage, take 2 tablets together daily, preferably before noon, away from food, medication, and other natural products. If you have trouble because you have all these supplements to kind of juggle, don't fret that you have to take these, without food. It's just, you want the absorption to be at its highest, and the clinical trials were carried out under these conditions. So that's how we know it works under these conditions. Do allow 8 weeks or 2 packs to achieve results. You saw in the previous 2 slides ago that's how long it took for 89% of the population that took them to see statistically relevant results. So give it a couple packs before you make a pure judgment, and continue to take it daily to maintain those results. And make sure, like I said before, measure your blood pressure regularly and often under the right conditions so that you know where you're actually sitting. Thank you, folks. I really appreciate your time. If you need to get a hold of me, if you have questions and you have to run before the end of this, or you already have, you can contact me at drdnjackson at most of the social media channels. You can reach out to me also through my website at www.drdwaynejackson.com. Thank you so much for your attention.